Hi, welcome everybody to today's FSHD University webinar. Today's topic is finding reliable health information. I should say we were saying it's on the internet, but I suppose it doesn't have to be online. But many of us get our information, our first source of information is the internet, or as we call Dr. Google. So our presenter today is Tina Griffin. Tina has a master's of library and information science and is associate professor and the library liaison to the colleges of pharmacy and medicine at the University of Illinois in Chicago. And she works with individuals and other community organizations to help them learn how to access data and information to advance their health education and research goals. So I know that many people in the FSHD community do go to the internet for information because there's never enough on FSHD. It's a work in progress.
Yes.
And how do you know what you're finding is trustworthy? That is the issue of the day. So Tina, I'm turning it over to you.
And thank you for the invitation. Thank you for inviting me to come and talk to you guys today. As a librarian, as a faculty member, this is what we talk about all the time. This is what we do to try to teach people how to find information and how to connect you guys to information. So I'm thrilled to see so many of you here today. Let's go ahead and get started. Let me just minimize a few things here so I can see my screen better. Okay, so finding health information is not always the problem. It's a question of finding good health information. So the topics in the way I've kind of structured what we're going to go through today. I have a number of different kind of objectives that I want to cover. And the first one is what do we mean by reliable? I might ask you guys from time to time to put some things into the chat, just to keep this a little bit more interactive. You're by no means obligated to do so, but it's nice to get a little feedback rather than me talking at you for the next half hour, 45 minutes or so. But I do want to cover some of these topics over the course of that time, which is what do we mean by reliable? And with reliability also comes with the authority of who gets to decide what's reliable and how did we come to that point of particularly science and health science determining what's reliable mostly, and how does lived experience of people having bodies, and seeking healthcare and health information fit into that big picture, because that's what ultimately has us seeking health information, right? We have questions, we have issues, and we don't have a science knowledge and background and base, and the variety of information that we have accessible to us varies. So we go looking for things. And when we do, it can be very confusing because the internet is a huge place. And as we mentioned in the beginning, yes, not everything is digitized, so not everything can be found on the internet, and what you do find is not always reliable. So where do you start? And a lot of that has to do with you have to be kind of clear about what you're looking for, because what you're looking for actually does tell you where to look. So we're going to start from there and then follow that path to actually find out where to look. And then once you found it, we're going to give you a little bit of an acronym to sift through what you find. And that sifting process is an evaluative process to help you figure out if what you found is actually reliable and applicable to what is useful for you. And then hopefully at the end, we'll have some time, we should have some time for questions and answers, time to go a little bit deeper into things if that's what you would like to do. And that is our agenda for today. Now, if there's anything beyond that that you think of or anything else you want to make sure that I cover, please go ahead and feel free to put that in our questions and answers. You can go ahead and do that now. But I'm going to go ahead and ask the first question, which is when I say reliable, what do we mean by reliable? If I ask you if something is reliable, What do you think the word reliable means? And you can go ahead and just put that in the chat. I'm going to go and pull the chat back up again. But what does reliable mean to you? If something is reliable. Trusted, trustworthy. A lot of people are saying evidence, which is always good to hear. Right. So a lot of people are saying very trustworthy, consistent. So reviewed by recognized experts, things like that. All good things. I went ahead and I pulled the definition from Merriam-Webster. You can pull it from a number of different dictionary definitions. And yeah, to be relied on or to be dependable. A medical definition can be, giving the same result on successful trials. But yes, we're looking for something that is accurate, dependable, something that is consistent. We want something to be the same over and over again, which means that it's not subject necessarily for debate. Something that is accurate as far as we understand it today. Now, I don't want to say that it's true. We can say it's true with an asterisk. And that means that it's true to the knowledge that we have today, right? Because science is always discovering new things. Science is always evolving. So yes, it's true right now. It can be accurate right now, but we can discover new things that would make it not true in the future. And we would have to update we would have to update what we understand about it. Which brings me to the idea of, reliable information and reliable health information would be true and accurate and dependable. And what we're seeing now, and what I'm sure all of you have experienced, which is why we're having this webinar, is how do we disambiguate reliable health information from these other types of information? And these are terms that you may or may not have run into yet. Which is, we have the information that we hope is reliable, which is true and accurate. But then we also have misinformation and we have disinformation. Have you guys heard of either misinformation or disinformation before? Again, you can put these into the chat if you've heard of either of these terms. Not really. Some people are saying yes, some misinformation, but maybe not disinformation. Okay. Misinformation, yes. Disinformation, no. Okay. So misinformation is information that's just incorrect. And this could be for some of the reasons that we've already talked about. Maybe it's just outdated information, right? There's any number of science concepts, for example, that maybe we haven't had an updated understanding of, right? When was the last time we took a science class or looked up a science fact on animals, for example? And our science facts are maybe just a little outdated, regarding tigers or, deep sea creatures or astronomy or things like that. If you haven't looked anything up or come across anything, you might have some misinformation about some science facts. This is not inherently bad or wrong. It's just inaccurate information. That's fine. We all have it. The question is whether or not we share that information, or whether or not we present our information as if it's true, right? Have we checked our information? Are we sharing information when we're not 100%, right? And this comes down to well, are we causing harm? Are we not causing harm? Are we, if we're sharing a little bit of thing, does it really matter that much? Well, if we're sharing a tiny little fact about an ant to a small child that you're walking on a walk? Probably not. But if you're sharing a piece of information that may or may not be factually accurate, or it's something that was accurate, but potentially was accurate 5 years ago, now that's a different case. We have to start thinking about whether or not, when and how we should be sharing information. Because we wander into the realm of, should we be sharing information? We should be checking whether or not it's true and accurate to the best of our knowledge right now, or are we sharing misinformation, right? Think twice before we kind of click that button. Or making sure that we communicate to the person that we're sharing, I'm not sure if this is accurate. This is what I know, but this information is old. This is when I learned it, and being very, very clear about the limits of our knowledge and when and how we understand things, right? Putting it out there very, very clearly. So again, misinformation, very innocent. It is, we all have it, but we do need to be cautious about it. Disinformation, on the other hand, is malicious. It is intentional, and it is meant to harm. This is where people who take misinformation and deliberately share it for the purpose of damaging whatever. And in the realm of human health, they are intending to do harm to other people, damage to do harm to health or health systems, things like that. We saw a lot of it being in the academic health sphere and in the academic health world. We saw a lot of it in the pandemic in particular, where there was countless amounts of conspiracy theories regarding vaccines rise again. The most obvious and ridiculous ones were things like the vaccine, the Pfizer vaccines are a conspiracy theory by the Chinese government to weaken the US population's immune systems, right? Like, they were egregious, obnoxious conspiracy theories. But they could be very, very subtle too. Those were active disinformation campaigns specifically designed to undermine people from getting healthcare. And that was their sole purpose, was to undermine people getting healthcare, to scare people away from getting a vaccine. It compounded hospital systems, it compounded illness and illness rates, it compounded the burden and the workload of people getting sick. It was a huge, huge problem. And it's not just in the healthcare system. We see disinformation campaigns of all kinds. We see them in the financial sector. We see them in academia. We see them in corporations. We see them in a lot of different spaces. Disinformation in the political sphere, especially. We're in an election year, so all of that is running rampant as well. But it is present. And so recognizing information and the types of information that we encounter, and whether it is true, accurate information to the best of our knowledge, misinformation or disinformation, is a very important distinction. Which then brings us to the question then of, okay, if we want to engage in reliable health information, then where does that authority and reliability and expert opinion come in, right? Who gets to create, or where is authority created, and where does that context come in? So I have about 5 or 6 slides about how that authority comes into play and where does that come in. Because I think we all kind of know, we're like, well, scientists, right? They do research and they do experiments. And this seems like a very nebulous thing for most of the public. If you're not at an academic institution, it's a big black box where people just do experiments. And I have done experiments. I actually, before becoming a librarian, was a research scientist, and I did work on the bench and things like that. So I do have experience on both ends of this, of how science works and the perspectives of how authority does get created. So let's talk about that. And I also want to talk about this not only from where authority comes from, but I want to talk about it from the perspective of patients seeing their healthcare provider, because we're seeing a lot of mistrust in going to the doctor, especially people with long-term illnesses, things like long COVID or genetic conditions, or like you guys, you come in and this is a condition that you live with and that you experience for the rest of your lives. And there is potentially this experience of, well, this wasn't my experience. This isn't what's happening with me, or this treatment isn't working for me, potentially. So the science must be wrong. And science hasn't historically done a really great job of communicating their findings, or also communicating why and how science works the way it does. And a lot of the science findings can be tucked behind paywalls and journal subscriptions and things like that. And by the time it does get to the public, we have played a really interesting game of telephone, of it going through a news press release and then picked up by the media. And then by the time it goes through 3 or 4 different hands and gets to some influencer on Instagram, it now no longer resembles or is communicated in the same way that original research study actually reported it. So I'm going to take these slides to hopefully explain a little bit of like, what does that research look like? And what do we mean when we say certain things? And hopefully bridge this gap a little bit to the degree that I'm able to, of, where does this authority come from, but also this lived experience of people in bodies. So let's start from types of sources. When clinicians of any kind, so this could be your doctor, physician, this could be a nurse practitioner, this could be PT, OT. When they go to school, we tend to think of them going to anatomy classes or learning how to do positioning or treatments and things like that. That is 100% what they're doing. But they're also given an evidence-based medicine or evidence-based practice class, typically. Or that evidence-based practice class is also embedded into all of these courses. And what we mean by evidence-based practice is they are taught to go into the scientific literature to find what is already being discussed and what is the research out there, both clinical research done on humans, and preclinical research that has been done on animals or other systems like cells or other synthetic type things, simulations, that is trying to test and see how the body works or how we can improve things. And they need to know how to do that because they take that research and try to figure out, okay, how can we make a drug work better? How can we improve body mechanics? How can we do all of these things? And that is what makes science go forward. That's how we make our treatments better, things like that. And some of this might be familiar to you. In high school, college, some of your primary education, this might sound familiar. There's primary literature, secondary literature, and tertiary literature. That hasn't changed. They're taught about these different kinds of literature sources, and those exist in the health sciences as well. So in the health sciences in particular, primary sources are the first reporting of research or any kind of scholarly work. In the health sciences, this is usually a research article, right? This is an experiment or a review, this is an experiment usually of some kind. And these are peer reviewed, and I'm going to talk about peer review shortly. So this is some sort of experiment or research study or observation. Secondary literature, it uses primary literature as their source of what they're studying. Reviews are examples of this. So this is, they took a bunch of other research articles and summarized them about what they saw as the sum total of this research. Because if you see something one time, that's great. If you see it a bunch of times, now maybe we can say we saw this more than once. These are also typically peer reviewed. Now, tertiary literature, on the other hand, is compilations that can be a variety of different things. They can be guidebooks, they can be textbooks, they can also be databases and other things. These aren't necessarily peer-reviewed, but they do have some sort of editorial processes, and they're usually also reviewed by experts in the field and things like that. So all of these types of literature exist, and your clinicians and physicians are taught how to go into the literature, how to search for these sources, how to evaluate these sources, where to go to find all of these things. Now, a quick side note on peer review. Slides don't want to advance. There we go. Peer review, you may have heard of this. It is when scientists review each other's work for validity, appropriate methodologies. Basically, did they do their experiments right? It looks something like this in very cute cartoon form. A scientist will study something. They will develop a hypothesis, or they will observe something and go, that's interesting. And they will write up their results. So we're talking right here about the left-hand side and moving down into this little diagram in the left middle. They'll write this up and they go, this is kind of interesting. The rest of the scientific community should learn about this. And so when they do, they send it to a journal. Now, journals have editorial policies about what is the scope of the journal. So you send it to somebody that is going to publish similar articles on similar topics. And they also send that journal article out to other scientists that are within the field. So these are people who are also experts on the subject who can properly evaluate what this first scientist has written. And they do this in a way that is blinded. So the reviewer who is reading the article doesn't know, like there's no identifying information in the article as to who wrote it. And the person who submitted the article doesn't know who's reviewing it. So it's a completely blind process. And the people who are reviewing it will give critical feedback as to the methodology. Was this done appropriate? Did they have the appropriate controls? Did they ask the right questions? Was it conducted appropriately? Do the results stand up to the methodology that you've chosen? They look very, very closely at whether or not this was done the right way and in the right format, and whether or not anything needs to be corrected, adjusted, if it can be. If it can't be, they will say, no, this was not done appropriately. This should be rejected and not published. If it can be corrected and adjusted, because sometimes it's just a question of clarification, sometimes additional experiments need to be done, things like that. They'll send it back to the journal editor, and that editor will summarize, again, still keeping everything blind, those comments and send it back to that scientist and say, hey, we think this has potential. Can you address these comments and send it back to us? And again, that might go through a few cycles. And if they do that and they resolve all of those comments and issues, they're like, great, we're going to go ahead and publish this, and the rest of the scientific community can benefit from it. And it gets published, and that is how science and progress goes forward. And if it doesn't, then the journal does not get published, or the journal article doesn't get published. And you have to go back and find a different research question, and things like that. So that is what peer review looks like. It's scientists looking at each other's work and critically reviewing it for flaws, and appropriateness and things like that. So peer review is a very essential part of this process, and it's done in a blinded, anonymous manner. Now, we talked about primary literature sources and secondary sources and things like that. I want to go a little bit further into this because these are the type of studies that tell us how research goes forward. And you've probably heard of some of these. There are studies out there that are just purely descriptive. Things like case reports or cohorts. And I'm not going to read all this. If you want to go back through the webinar, and we're going to have a version of these slides available to you later. But case reports and cohort stories are things that are observational in nature, right? They look at a human group of people and they have observed something. Whereas evaluative studies are the things that we normally think of when we think of a clinical study or a clinical trial. It might be an intervention in the sense of we have given drug A and drug B and we want to see which one works better. Evaluative studies also work in a number of different settings, like education, right? If we teach you how to eat better, will you have better outcomes, right? If we teach you how to move better, will you have less falls? Things like that. So evaluative studies are typically what we think of when we think of research studies or clinical studies. And the gold standard, that's one of the highest studies, is the randomized controlled trial. Now, the randomized controlled trial is the one where we're typically doing an intervention where everybody is blinded. So you get one treatment group and a control group that you're comparing it to. And it is completely random as to whether or not you get into the control group or you get into the treatment group. And you're looking at whether or not you see differences between those two. And if you do see differences, then you're like, this is great. This intervention would be a success, and this is what we want to see. Now, it's not always appropriate to do a randomized control trial for every study, which is why sometimes they don't do them for everything. But that's the thing that we like to see, because that is the most rigorous level, is when you can get that level of blinding and you can get that level of grouping to see truly are what we're seeing as an effect. So that's why you hear about randomized controlled trials so often. And a lot of studies are published about those. And then we get things like longitudinal studies, which studies a group of people over time. So these are types of studies that you would see in those research articles and in primary literature and things like that. Now, secondary studies, these are studies that use primary literature. You might run into a few of these or heard of these, are like systematic reviews, meta-analyses, and practice guidelines. I bring some of these up because systematic reviews are becoming more and more popular. We've done so much research now as a species that we want to find out, again, from those randomized controlled trials, people will do a trial, they'll enroll a lot of people in them. And they're like, well, we see an effect and this is great. But another group will do another trial and they're like, well, we don't see as much of an effect. And they'll do this over and over again with subtle differences. But we want to see, okay, over an aggregate large amount of group of people, if we can compare all of these studies, what do we see? So this gives us a way to compare studies to one another. And systematic reviews are the ones that do that. Now, meta-analysis are basically systematic reviews plus a lot of really highly complicated statistical math. And that's what I usually tell people what they are, is systematic reviews plus math. And that's what those do, is they add a statistical layer to that. And practice guidelines are where you take a lot of these studies, things like systematic reviews, meta-analysis, a lot of the different studies that we talked about in all of the previous slides, and clinicians get together as large groups and experts in the field, and they take all of this together and go, okay, we now have a large amount of information about a group of people that are, say, have heart disease, have heart failure, are suffering from heart attacks. What should be the frontline first responder standard of care for dealing with this thing? Because this is what we see is effective for this population. Now, again, does that work for a given individual? Not sure. Every individual that walks in is going to be different, but it does give us a starting place rather than everybody kind of doing their own thing. And it's a much more effective way to determine a standard baseline of care. And because of that, we have had leaps and bounds of overall increases of health outcomes for everyone across the board. Life expectancy across the board for the human race has gone up for the past 50 years in ways that it hasn't before. And it's because we're doing this kind of work. Systematic reviews, these kind of research studies, practice guidelines, and things like that, because we have this power now. And when you take all of this together, this is what scientists are doing. There's a place for all of this research. There's no research that's good or bad. there's just what we call different levels of evidence. There's expert opinion all the way up through these systematic reviews and meta-analyses, right? And there's a place for all of it. There's a use for all of it in different ways and forms. So when you go into a doctor's office or when you see your clinicians, what they're doing is they're pulling all of this. They're either actively looking for it by themselves or consulting with somebody like me to find what works, for the patient that's in front of me in the clinic that you're in, what is most similar or what could be applicable for the patient that I'm seeing or for the group of patients that I see regularly. They're looking through things like this. And there's other things out there too. Editorials, commentaries, data sets of books and conference materials and things like that. These things exist too. We don't reference them quite as much. These are usually things where it's like we've noticed something, and as the work gets bigger or more noticed or more people see it, then it starts evolving into research and research articles like we've seen before. But that brings us to lived experience, right? Because if doctors are living in this world where they live with this research articles and they live in this space where we're constantly doing research studies and clinical, they're constantly dealing with literature that is dealing with patients as large groups and patients that are always in aggregate. And you come in as an individual, right? And you come in with an experience that is, well, this may or may not work for me. And they know this, right? They know this, that because even in those research studies, even though we see 50, 60, 70%, 30% success rate for whatever study it happened to be, that means there was a portion of people that it didn't work for. But we have to start somewhere with a treatment option, right? We have to pick something to start with. But they also know that you live in your body every day. So you get the opportunity to be a collaborator in your care and have that conversation of like, okay, well, this may not work for me. And that you are knowledgeable as an individual, right? We can't generalize from you, and you can't generalize for you to another person, right? Just because it didn't work for you doesn't mean it's not going to work for anybody else, right? That's not how this works either. And the more people that come in sharing their lived experience, and the more people that come in that are willing to share their lived experience and communicate as collaborators in their care, also get the opportunity to, improve research with things like community participatory research opportunities and things like that. There is places there where research studies can be designed differently so that it includes lived experiences or things like that. Like we're starting to see more of that where this is here. And that's an important component of, I think, what is actually coming in the future is how do we get to a point where we are blending this knowledge and going forward so that we can make even further leaps and bounds, but it does come at a point where we are sharing our health knowledge, your lived experience, as well as the scientific knowledge that we're actually building. So we have this lived experience, we have this huge volume of health information, but this health information lives in journals. So how do we get there from here? Right? Because this is that body of knowledge, but it's also highly technical, which you may or may not be comfortable with. So where do we go from this? And that comes down to, what are you looking for? Getting at health information, you have to kind of figure out, are you looking for general information or are you looking for specific information? So general information, what we mean by that is, are you asking a kind of a simple question? Can it be asked, or is it asked as a who, what, where, when, or why kind of thing? Is it a general knowledge question about a disease or a condition or something like that? So for example, how is heart failure different from a heart attack? That is a general question. it sounds specific and it sounds sciencey because it is a health science question, but it is actually a general information question. That is different from a specific information question, which could, when you're trying to do something like make a clinical decision, and it can include a broad range of either biological or psychological or sociological issues or points that you're trying to figure out. So a specific question might look something like, if we add this drug to a therapy regimen, are we going to reduce my chance of a thromboembolism, right? How do I lower my risk factor for this? Can I add this drug, right? That's a more specific question. So if you're looking for general information, there's a number of different sources that you would start with. First is textbooks, weirdly enough. Textbooks are a great source. I would kind of say, see if you can get them 3 to 5 years old or less, if you can. And places that you can look for these, public libraries are great. They have general science textbooks in a lot of cases. If you have the money and the means, places like Half Price Books, textbook.com, amazon.com has textbook options. Used textbooks abound, and they can be had for fairly cheaply. If you want a general textbook to just have at hand, especially if there's a chronic condition where you want to look things up. But public libraries are there. If you are in a metropolitan area or a reasonable metropolitan area, medical libraries have textbooks that you can just walk in and use in most cases. So find out if you have access to a medical library. And medical libraries, at least in the US, if the medical library, if you can find out if your hospital has a medical library, it probably doesn't have a medical library. If it's just a hospital, it's not like an academic medical system that like has an attached teaching hospital and things like that. If it has a teaching hospital and things like that, it probably has textbooks. If it's just a straight hospital, it may or may not have textbooks with it, but you still might be able to get help. So it might be worth the next time you have an appointment at a hospital or something like that, seeing if you can go to the hospital library and make some time with the medical librarian there and see if you can get some, see if they have a consumer health source or something like that. Sometimes they have some consumer health resources and things like that that you can do. So you might want to consider extra time the next time you go to the doctor's office. If you're at a hospital or nearby a hospital, you can kind of find out whether or not that's accessible to you there. Another place to go is Medline Plus. Medline Plus has some great general information on disease, health conditions. You can search by topic. You can search specifically what you're looking for health information. It's very easy, and they're putting these links for you down in the chat. Medline Plus is a great place to go in and just search. And in the Q&A, I can go to anyone's. I'm listing a whole bunch of them, so if you want to go to these afterwards, if there's ones you're particularly interested in and want a demo of, I'm happy to go to these. So keep an eye on what piques your interest. We can go there. Medline Plus is a great one for general health information on disease and disease states and a certain amount of that. The Centers for Disease Control, most people think of them for things like diseases and vaccine information, things like that, but they do have a whole health topics section. So that's another good one to go to for just general health. If you're interested in complementary and integrative health, this is more for, to complement other, it doesn't replace, but it complements other health approaches. So it's like herbs and supplements in addition to, or acupuncture in addition to other modalities of what we would use for, like, say, pain management. So acupuncture in addition to other pain management strategies, like how effective is it? What do we know about it? Things like that. So far, all of these are all US government sources that are run and very reliable about their health information. So any one of these you can go to, they're there. Interestingly enough, another good place And you're going to have to use the SIFT method that I'm going to talk about in a little bit, but YouTube can also be a really great place for just general information. If you want to know how heart failure works, there's some really great videos from like Yale Medicine that are 2 minutes long that talk about heart failure, heart disease, things like that. And it's just a question of like double checking the source and going through your SIFT method really quick. But there's some really great YouTube videos that you can find about just general biological questions and processes that you can find. Just making sure that you're finding a good authority and a reliable source when you're doing it. You can find great YouTube videos for just general information. And then also, I lumped these last three together, but if you're interested in doing a little bit longer, a deep dive for general things, you can also just take general courses. Coursera has a number of free courses. Actually, all of these, Coursera, Harvard Online, and MIT, have a number of biology and health topics courses. So if you just wanted a general refresher on biology topics and subjects, you could take a free biology course, a free health topics course, and a number of different subjects, and go in, and even if you don't complete them, or you can just watch a few of the lectures to get an idea about the topic itself and kind of refresh your knowledge base about that subject. So Coursera and some of these are really, really great for getting that general knowledge base up for just these general subjects. So these are all really great sources to kind of start with. Now, for more specific, if you do have those specific questions, again, you're going to want to consult your doctor. You're going to want to consult a medical librarian. But some of the places that we would direct you to is PubMed. This is the place where we go. This is where you're going to get those research articles, the clinical studies, the guidelines. PubMed and PubMed Central are all going to be there. Directory of open access journals. Now, all of the content that's in there, you're not going to have access to because it links out to things that are subscription only. So you will have to either talk to a medical library or go to the public library and get interlibrary loan access, or there's PubMed Central, you'll have access to everything. Directory of open access journals, you'll have access to everything. PubMed itself, you'll have to use the free full text filter or go to a medical library or public library to get something in case you don't have access to it. Some of it is subscription only, but you can still read the abstracts to get an idea of whether or not the article would be of interest. But again, it's highly technical information, a lot of cases, but there still could be a review article in there that is a summary that still might be very useful for you. So if you are doing some in-depth research and you're getting really into it and it is something of interest, you can go there. Absolutely. It's open to everybody. If you're more interested in some of the drug resources, the Office of Dietary Supplements has a website that is open to everybody and you're looking for drug information, as well as the Food and Drug Administration has a number of, their website has a number of subset websites within it that has a lot of information in there. The FDA website can be a little bit difficult to navigate at times, but they have things like drug labels, a drug pill lookup, things like that are all within there as well. So if you're looking for specific information, some of that is going to be, again, getting into those research articles and things like that. So these are some great sources to start with. All of them are reliable and good places to start. Now, if you do go to a medical library or something like that, and you can get access to that, there will be other consumer health sources that could be available to you. Some libraries, either public libraries, have consumer health subscribed things. So still check your public library. I didn't link some of those because every library could subscribe to something different. Like here at UIC, we subscribe to something called Consumer Health Complete, but not every library has that. But you do want to check your public libraries, check your medical libraries if you have one nearby. There probably is something similar, or could be something similar, a consumer health database that they might have access to. So that would kind of bridge the gap between some of those special sources and some of these general sources as well. So that would also be in here. And then as you're looking through these sources, whether it's a general source or whether it's a specific source, do things like keep track of the names of people. The names of people, the names of institutions, the names of institutes or centers or things like that. And when you keep track of those names, you'll run across them again as either people share them, you might run across them in social media. We're finding that a lot of doctors and institutes and centers are starting to do better science communication and better outreach. And so they are doing things like creating Facebook pages and Facebook groups for that, and follow them there. So make sure that you're following the experts, because they are coming across in other regions and pages, and that's a way to actually get access where they put it in a very accessible manner, where you don't have to read the research article. They'll distill it down into something that is less technical, because even I don't like to read all the heavyweight research articles day in and day out all the time. I'm like, just give me the summary sometimes. But it is a nice way to kind of keep up with some of what's going on. And I know several people follow a couple of the Facebook groups that are actually linked to researchers, because they know that's where your community is they're looking at some of the stuff on Facebook. So they created Facebook groups, which is great. That is a great way to keep up with some of this stuff. Just make sure that you're following the researcher, not necessarily some of these other groups. Some of the support groups can be great, but just again, watch about how you're evaluating the information that you're getting from them to make sure it's not misinformation or not disinformation, hopefully. So again, getting back to that misinformation and disinformation, you are going to get information. Like, it's not hard to find information. You can look at any or all of these places, but you're also going to get it shared through social media. People are going to give things to you. You're going to run across news headlines. So when you find this stuff, however it comes across your path, what do you do with it? How do you evaluate it? And that's the last thing that we're going to talk about today. And I'm going to give you an acronym, which is SIFT. And that is to stop, investigate, find, and trace. And this is what I would hope you would remember, is to do these 4 steps in order to evaluate what you do find. And I'm going to go through these 4. So stop, it's pretty straightforward. Don't automatically accept the information as factually accurate. It's really easy. Let's assume somebody was just being generous and, hey, I heard about this research study. I'm going to forward you this link. And you look at the link and it says it was a clinical study, but was it really? Right? How do we know that it really was a clinical study? So we're going to have to actually take a look at it and see, was this a clinical study or not? How do we know that it is? And some of that is going to be, well, who wrote it? But we'll get to the investigate part in a second. But as we stop and kind of look through that, the other thing I want to stop and do is actually think about, what am I feeling as I'm getting this piece of information in? Because it's really, really tempting to want this information to be true. There's a reason that we stopped and we clicked on that link. We were curious about it. It sounded really promising. We wanted to believe it for some reason. We stopped on it. So we have to check ourselves for just a second and make sure that, what are we being influenced a little bit? What are we believing about what we're reading already? Was that title super flashy? Did it catch our interest? Why did that catch our interest? Because there's some biases already in place about us wanting to believe it. Are we just tired of dealing with this today? Are we just not happy with ourselves and our body and the way it's operating today? Do we just want an answer? That leads us to want to believe things. Because that's the way we are as humans. We want to believe things. I get it. So once we've stopped, we need to start actually investigating a little bit further. And this is, what is the authority of the source? So where did this really come from? Is it an influencer? Is it really a physician? Is it somewhere between that? But also, what's the purpose of the page and the source? And some of that can be very mixed, right? It used to be like, does the page have ads? Are they trying to sell you something? Automatically, you can discard it. That's not the case so much anymore. A lot of pages have ads just to keep the web page going. It's not ideal, but there are a lot of physicians who are, selling their own supplements and things like that. Is that necessarily a bad thing? Not necessarily. A lot of them put things out there and then also link to original research. Are they biased? Absolutely. Absolutely. Right? But if they're linking to the original research and you're going to read the original research paper, can you disassociate from that? Maybe. Like, you have to think about that. So what's the purpose of the page? What's the purpose of the source? Also, how old is that information? And is it fact or opinion, right? Pay very close attention to how people are presenting that information to you. Are they selling it like it is the gospel truth? Are they being unbiased about it? Or are they actually stating limitations? Good research studies tell you limitations. They're always stating a limitation. This is what we know, this is what we don't know, and here's where that boundary stops. This is where it doesn't apply, this is what we don't know. Every research study will do this. This is what it does. So stop and then investigate. Then the next thing that you do is, once you investigate, is go look somewhere else. Go and find out, is there more information that agrees with this? Because again, it is very rare that we find something that is truly novel and original that nobody else has ever seen or studied or looked at before, ever. So there's more information out there. And if there isn't more information out there, be very suspect. It is extraordinarily rare that there's only one piece of information, and this is only it. And this has got the answer. So that's it. So when you find that other information, who is the most authoritative person that agrees with that information? Because again, you can find more information that agrees, but who's the most authoritative voice in that? Because if it's just a bunch of influencers who are all just saying the same thing and nobody else other than that is saying that, okay. Who got paid to do this, and why are they getting paid to say this? Like, where is this all coming from? But the other thing that could also be happening is there is a lot of conversation going about it, and some people agree and some people disagree, and there's a lot of authority in the room. Where are they agreeing and disagreeing? And why are they agreeing and disagreeing? Pay attention to that conversation too. Could be that the disagreeing is something minor. It could be something major. That's something that you'll have to decide for yourself. But it's notable to be there. And again, find out what that is. And then if you can, depends on where the source is that you started with. But again, if you did find something that came across on social media or in a news headline or whatever, trace it back as far as you can and get as close as you can to the original source if you can. And then when you go back to the original source, try to see if you can backtrack through this game of telephone. Can you construct or reconstruct the context of what was originally meant? Because again, you clicked on something because it was interesting and it caught your attention and you responded to it. But was that what was originally meant in there? And was it accurately presented there? Because in a lot of cases, that gets warped along the way. And maybe it was blown out of proportion a little bit, or let's go back to that phrase about limitations. Those limitations usually get stripped out of there somewhere. So where is that limitation? Where does it apply and not apply, or where might have been overstated, right? So stop, investigate, find, and trace when you find the information that you do find. So a couple of red flags, and then we're going to wrap up with our summary and start in with our questions and answers. Red flags, always anonymous information. If you cannot find anybody that puts their name to this, that is always a red flag. If it's just information that's out there and no name or institution or company or anything's attached to it, nope, trash it. Conflicts of interest, either stated or unstated. These could be financial conflicts of interest. These could be political conflicts of interest, things like that. So keep an eye out for those. Outdated information. If the information is old, see if you can find things that are current. Science does move fairly quickly. Sometimes it can be a while before, things get trendy in terms of like how long, what people study and research, but it should not be, 10 years old. Again, textbooks 3 to 5 years old, but most information should be fairly current. No miracle or secret cures. There aren't any. There just isn't. We see that. Also, if they're not citing any evidence, and I do mean real evidence, like can you trace it back to a clinical study and a legitimate clinical study? Like, can you actually find the article? And they will cite things. This is the thing that's getting really interesting with AI too, is you can actually fake a citation. So a lot of things will put a citation down there, but go and see if you can actually find the article. Go to PubMed or something like that, because you can search PubMed. And if you take that citation and you try to find the article and it's not there, then it doesn't exist. PubMed doesn't have everything, but it's got a lot. Or take it to a medical library or a library anywhere and just be like, hey, can you help me find this article? Like, if you can't find it, then yeah, check the citations. They can be faked. That is one of the things that we actually do occasionally, is try to hunt down citations for people, and they can be faked. We run into that. Grammar, technical, spelling errors, things like that. Biased presentations. Those are usually pretty obvious to catch as well. And just be generally aware of consumer fraud scams. I did put a link here. I think I forgot to put that in the chat, but consumer health frauds do exist. Fraud scams are definitely out there. But there is a link to help you identify those that are. So in summary, we do want to avoid spreading information and actively fight disinformation. Authority is through understanding scientific method, information, and application. All of those kind of go together. Authority is constructed. But your experience and lived experience has a place in all this and in health decision making, not only for yourself, but for everybody else. So as you go through and you're finding your health information through these sources and other things, sift to evaluate the information that you do find and beware of these red flags. And I look forward to all of your questions, and thank you again for inviting me here today.
Wow. Thank you so much. That was really definitive. And
It was. Yes. And I got to notice that the hour is up. I'm sorry that ran a little longer, but I'm still available to answer questions for anyone who wants to stay on.
Yes. If there are any questions, please put them in the Q&A. You might have touched on this, but one thing I was wondering about is the importance of looking at who the author is and whether they have potential conflicts of interest. And I think most peer-reviewed journals these days require that authors state any conflicts of interest if they're getting consulting fees or stock or anything from companies that they're reporting on and so on.
The degrees to which journals disclose that is up to the journals and the journal editors. So yes, you can look if you're looking at journals. So journals themselves and research articles, authors are required to disclose conflicts of interest. And there's usually a standardized, fairly straightforward 4 or 5 question conflict of interest disclosure form. And it's not only for the author, but it's also usually the author and any immediate family. So like, is you or your spouse receiving funds, have stock shares in any company, or are you employed by whatever? So it is possible. Now, is a conflict of interest automatically a red flag? Not necessarily. There's a lot of people who have dual appointment, joint appointment, or have received funding to do research on behalf of, say, a pharma company to do whatever. And that's pretty common in academia, where you have people who are appointed by, and their primary job is to work at an academic institution, but pharma doesn't always have the manpower, the technical skills, the expertise, the equipment, or what have you, or they don't want, you know, they want the unbiasedness that academia has.
Mhm.
So they outsource that to being like, hey, we need a research partner in academia. We need somebody to test drug. So we're just going to give you the drug to do the thing. And they literally ship the drug to you and you do the thing. And they're not really involved other than giving you the drug for free to be like, we want you to do this and we want to do this human study or we want to do this animal study. And I've been involved in labs that do this, where they just give you the drug and they say, we want you to test this in animals. And does this drug heal? Like we did a wound healing study, does it help for wound healing? And so you just have to disclose that.
Yeah, well, that's the important thing. It's that it's disclosed, and then you
disclosed.
can use your own discretion to
Exactly.
decide how much credence.
Yep. So it's not necessarily a bad thing. It's important that the disclosure happens.
Yes, that's a good point.
Yes. So I see a question with FSHD, no official cure treatment exists. A lot of information or helping treatments are anecdotal, usually about supplements, diets, programs, etc. How do you best navigate that? Oh, good question. So again, this comes down to, yes, supplements, diet, this comes down to that lived experience versus scientific knowledge-based kind of question. Again, some of this is the conversations that you have with your clinicians, because obviously lived experience applies to an individual only, right? So if you want to try a supplement, a diet, a program, and things like that, do some research about that supplement, diet, program, whatever you're interested in that you think may help you, but then take that to your clinician and go, you know what? This is what I'm experiencing. This is what I think might help me. And talk with them about how that fits into the treatment plan that they already have in line for you, and whether or not that would be counter to a drug that you're already taking for maybe some other reason. Because that's the thing with supplements and diets. You do have to pay attention that if you're taking a supplement in particular, or have a certain diet, that if you're deciding to add something on, that you're also not messing something else up. And that is irrespective of FSHD. But if you're doing something like that, yeah, you're going to have to do a little extra work. And then it's a try it kind of situation. Try it out for a while, see if it's going to work for you. And if it does, great, keep going. And it might be a situation where you have a lot of conversations with other people about how and why this worked for you. Now, this is the situation where in the literature, if people were to write that up, this would be a case report. You would look for things like case reports and stories like that, where people would have done something like that, or a doctor would have observed something like that and had written it up. That's more of that. Case reports are as close as what you get in science to being anecdotal, where they're like, we saw this, we observed it, and we wanted to report out. That's the science version of anecdotes. But yeah.
Okay.
Does that answer your question?
That's a great answer, I think. And I'm afraid I have another meeting I have to hop off to.
Okay.
So
if
once
anybody has
again,
any further questions, though, you can forward them on to me. I'm happy to answer them. I am still answering questions from the last webinar. I think I only have a couple left because you guys all sent me multi-part questions, which were amazing. They take time to go through. And I'm almost done with the last, I think, two.
So absolutely. If anyone has questions for Tina, I think you all have my email, and I can send them along to her, and she'll be very happy to listen to them. So thank you for today's wonderful webinar. Next month, we will have a webinar, what we're calling on family communication. So we hear from a lot of people that their family members or friends don't always understand what they're going through with their FSHD or how best to support them. And so we've invited a number of people who will want to share their stories, and also a psychological counselor who can kind of make some suggestions on how about to navigate these kinds of situations. So we hope to see you there. And with that, thank you, everybody.
Thanks, everyone.